Well, substance use disorders are common and complicated, as is schizophrenia. So what would you do when you have a patient that actually has both disorders?
So actually the combination of both disorders is quite difficult to treat, as the lifestyle of schizophrenic patients very often is related to a lot of free time in their gathering. They have this kind of assortative mating, and of course they are also very much involved mostly with cannabis. But also quite often we see a combination also with other drugs like alcohol and also cocaine, because the schizophrenics tend to say they are down because of their medication and they want to fill and they want to have some drive, so they go and get some psychoactive drugs. My recommendation basically is we try, if it's not possible on an outpatient basis, to admit these patients and try to, it's much easier if they're away from the drug scene, to treat their schizophrenia and stabilize and reevaluate the medication.
Yes, so that's really important, but often patients don't want to be admitted, and in some settings it's hard when they're just still semi-functioning. I see the problem that basically schizophrenia has a lot of reward-related issues, and sometimes it's not just to counter the dopamine blockade of the medications, but also maybe to self-medicate this lack of drive, lack of hedonic value. And so how do we get patients excited about other things? They often have a rarefied life, they have nothing to look forward for, and may have even problem with anticipating joy. So maybe, I don't know whether you found that motivational interviewing can be helpful. Do you want certain things in your life? And well, now that you're using drugs in addition to having schizophrenia, actually doesn't get you there. And also, the problem I think is a lot that when they ask themselves on the weekend, do I take my drug or your drug, there's non-adherence with antipsychotics. So sometimes we may have to push for long-acting injectables so that patients realize, okay, once I'm stable, maybe if I have a glitch and use some substances, I don't have to go again to the hospital against my will. But it's a complicated co-treatment of these disorders, and we need a team approach. I mean, you and I alone can't do that. We need nurses, we need substance use specialists who can counsel, and maybe even peer counselors or subgroups of peers that get together in order to combat this very strong urge to use substances. And we need actually more research, because the problem is these patients are so much excluded from the studies that give us evidence. So we need more evidence that hopefully in the future can lead more the way how to treat these patients.
Well, I totally agree. I just think it's depending on the acute state. You know, if somebody you have really psychotic, there is no way to perform motivational interviewing. What I have been learning with our team and with really trained nurses, that unfortunately a lot of patients with schizophrenia and co-occurrent substance use end up in correctional settings. In these, they don't want it all. So occasionally it really can be helpful of picturing that if they are not compliant, if they are not agreed to a structured outpatient treatment or even an inpatient treatment, they might end up again in a correctional setting. So this, in my experience, is kind of helpful.
Great, thank you very much.
Thank you.